In those first critical moments after a severe head injury, there's a battle going on that can literally decide a person's entire future. Today, we're going to break down the playbook that first responders use to win that fight. It's called the EPIC TBI Protocol. Think of it as a strategy designed to shield the brain when it is absolutely at its most vulnerable. So, when someone suffers a traumatic brain injury, what's the biggest, most immediate threat? You might think it's the initial hit itself, right? But believe it or not, that's only half the story. That first impact, that's just the beginning of the problem.
See, the real battle is fought in the minutes and hours that come after the accident. It's a fight against what doctors call the second injury. And this is the key part. It's damage that's preventable, damage that happens after the initial trauma. And stopping that second injury, that's exactly what this protocol is all about.
So how do you shield the brain from this extra damage? Well, it all comes down to a surprisingly simple but incredibly powerful strategy. It's about fighting three specific, silent enemies, and they go by a simple name, the three H's. All right, here's the mission, plain and simple. Prevent hypoxia, prevent hypertension, and prevent hyperventilation. It is a three-part mission for protecting the brain. You get these three things right, and you are giving that person the absolute best shot they have at recovery. So let's break down what these threats actually are.
Okay, first up, hypoxia. Put simply, this just means the brain isn't getting enough oxygen. After an injury, the brain is under a massive amount of stress, and it is desperate for oxygen to even begin to heal. Hypoxia is like starving it of air right at its moment of greatest need. It's a total emergency.
Next, we've got hypotension, which is just abnormally low blood pressure. And this one is tied right into the first problem. If hypoxia is a lack of oxygen, well, hypotension is the failure of the delivery system. Low blood pressure means not enough blood is getting pumped to the brain to deliver that oxygen in the first place. They are a truly deadly combination. And this right here really gets to the heart of the whole thing. The protocol isn't about waiting for a disaster to happen, it's about preventing one from ever starting. The guidelines are crystal clear. You watch the vital signs like a hawk and you start treatment before a person's oxygen or blood pressure ever drops into the danger zone. It's proactive, not reactive. All right, so let's see what this actually looks like in practice. Starting with priority number 1, oxygen. This whole part is about managing the patient's breathing to make sure the brain gets the fuel it is so desperately crying out for.
Now, the protocol is super clear about this. For any patient with a traumatic brain injury, the goal for oxygen saturation is 100%. Not 98%, not 95%, 100. The message couldn't be clearer. An injured brain needs every last molecule of oxygen it can get.
But here's the catch. It's not as simple as just cranking up the oxygen. How that oxygen gets delivered, specifically the rate of breathing, is just as critical, because breathing too fast or hyperventilating can actually make things a whole lot worse.
So why is that? Well, when you hyperventilate, it causes the blood vessels in the brain to tighten up, to constrict. And when they do that, it chokes off blood flow, which, ironically enough, means less oxygen is getting to the brain tissue. The goal is to find that perfect, just right breathing rate to keep a steady supply flowing. And finding that sweet spot isn't guesswork at all. It's a precise number based on how old the patient is. I mean, just look at how different these numbers are. An infant needs 25 breaths a minute, but an adult needs just 10. That's because their bodies are just totally different. This is the kind of precision that makes the protocol so effective. Okay, so we've got the oxygen supply handled. Now we move to priority number 2. Blood pressure. This is all about making sure that all that oxygen-rich blood actually gets to where it needs to go, the brain.
Here's a really easy way to think about it. If oxygen is the fuel that powers the brain's recovery, then blood pressure is the fuel line. And if that pressure drops, well, the fuel line is busted, and the engine, the brain, is going to stall out. So keeping that pressure up isn't just important, it's non-negotiable. So what's the magic number? When do first responders jump into action? For adults, any systolic blood pressure reading below 110 is like a fire alarm going off. It is a blaring signal that the brain's fuel line is failing, and they need to intervene right now. And no surprise here, just like with the breathing rates, these blood pressure targets are tailored for the patient's age. The safe minimum for an adult is 90, but for little kids, they even have this handy little formula they can use right there on the spot, 70 plus 2 times their age. It's that kind of precision that ensures every single patient gets exactly the care they need. So when that alarm goes off, The response is immediate. Responders give a rapid infusion of IV fluids. It's called a fluid bolus. And the amount is calculated specifically for that person's weight. And they don't just do it once. They repeat it until the pressure comes back up, checking vitals every 3 to 5 minutes. It's this constant cycle of treating, checking, to manage the crisis.
So let's zoom out and look at the big picture. Why does this super structured, numbers-driven approach actually save lives? Let's bring it all together. The whole mission really boils down to this: get ahead of that second injury. You do that by stopping the 3 H's. By focusing on those, you make sure the brain gets the 2 things it needs more than anything else: oxygen and blood flow. And it all works because it gives first responders simple, clear, and specific targets to hit for every single patient. So in the end, you have to realize this protocol isn't just some checklist to tick off. It's so much more than that. It's an active shield. It's a strategy that protects the brain during that incredibly fragile window after an injury, giving it the best possible chance to start the long road to recovery.
And that really leaves us with one final, pretty powerful thought. In all the chaos of an emergency, could this incredibly focused approach on just oxygen and blood pressure, could that really be the difference between someone making a full recovery and someone having permanent brain damage? Well, all the evidence we're seeing from the field suggests that for a whole lot of people, the answer is a definitive yes.